Fred.
We're live, actually.
Oh, are you live? Okay, hi.
Hey, Kim.
Hey, Fred. How are you?
Good. I'm with Dr. Kim Fagan today, and I'm in Kim's office, and hopefully one day I'll be better where I can give everybody a tour of your office. Your office is exciting to see. Dr. Fagan is a sports medicine specialist, but your practice has really evolved over the years, and I'm interested in the evolution. So tell us a little bit about sports medicine and then how it's evolved, and I want to know why it's evolved.
Sure. So sports medicine. So I'm a little bit different in that I'm not an orthopedic surgeon. So I'm what we refer to as a primary care sports medicine doctor, in that I don't do surgery. So primary care sports medicine started in 1991, around that time. So I was kind of the inaugural group, in that I was at the very first primary care sports medicine meeting. And around that time, there were about 100 of us at that meeting. I was one of the 5 women at the meeting.
Wow.
Yeah, and so we have probably over 3,000 members in that group.
You know, I met a woman, I'm blanking on her name, I wanted to do a show with her from Canada, who was the team physician for the Toronto Maple Leafs, excuse me, and probably the Blue Jays as well. And she was a big tennis player too.
I would probably know her.
That's why I'm wishing I could come up with her name. But she was probably one of those 5 people that was with you.
I'm sure she was.
All right, go ahead.
Yeah, and so, it's been fun to kind of evolve. It was, at the beginning, even getting into a locker room was kind of a difficult thing.
I can imagine.
And there was a lot of hazing that went on with women because it was so new at the time. So it's been fun to be part of that group that's kind of been part of the original group. And so it has been an interesting career, and a very fun career, and that you're taking care of really healthy people, basically, who have sports injuries, and you're really trying to help them get back to their sport and back in the game. And so, again, a very fun career, and that I've been very happy to be a part of.
But it's evolved.
Oh, very much has
I mean,
evolved.
when we walked around, I saw a bod pod, which I guess tells it how much fat you have.
Absolutely.
Like doing the water thing, where you get in a water tank, and it's the same thing, but it uses air, right?
That's exactly right.
And then I saw the cool sculpting, which gets rid of the fat.
Exactly.
And then the exercise treadmill for VO2 Max. So there's a lot more going on here than tennis elbow.
Right. So not only do I take care of injuries now, but my background also was internal medicine. So what I tried to do was combine not only sports medicine, but my internal medicine background. So I want to help keep people healthy too. So not just taking care of their injuries, but their overall health and wellness. And so people come in now and say, I'm maybe not feeling at my best, or I'd like to get healthier. And so they'll come in, and what we do is we say, okay, if you want to be your best, we have to look at other things.
So, okay, I'm going to speak from personal experience, okay? I don't want to say I'm an athlete. I like to play sports, okay?
Right.
And I play at a competitive level. But what I'm interested in is performance enhancement. Now Barry Bonds, and I always think of baseball when I think of performance enhancement, because you can measure, or even Lance Armstrong, their performances are measurable.
Exactly.
And clearly they, quote unquote, cheated because they used means to enhance their performance. But I want to enhance my performance to enhance my life. I want to be able to play longer, play harder, play younger opponents, all those things. And I feel like we've been cheated because we don't really understand what Barry Bonds may have taken, or Lance Armstrong, or any of those athletes, but clearly they made a difference in their ability to perform.
Oh, absolutely.
So I would imagine you are seeing people like me, or people that are interested in that. And
Absolutely.
How do you approach me? How would you approach me?
Okay, so if you came in and you said, look, I want to make sure I'm at my peak.
Exactly.
And what can I do to help make sure of that? So where I'd probably start is to sit down with you and say, okay, let's make sure your vitamins and minerals are where they need to be. And so we would do expanded lab panels and look at all your vitamins and minerals, your hormones, your expanded
let's say all of
thyroids.
that was within normal limits.
Yes. Well, there's normal limits and there's optimal limits.
Okay.
So you want to be at your optimal and not your normal range.
What would be an example of an area where I could be suboptimal? That everything's normal, because I know my labs.
Yeah.
I know they're all normal. But what would be a common example of what you would think something is normal but suboptimal?
I think the thing I see most often would be, say, B vitamins, for instance. B vitamins are, you can have optimal range and then sort of suboptimal, but still in the normal range.
Okay,
and
that's a good one. So I have a B12 deficiency issue.
Right.
And it's normal, and I do take a B12 shot once a month.
Right. So
So
B
you
vitamins,
nailed that one.
Right.
Okay.
B vitamins should be really 700 or at least.
Right, mine was probably like 300, and the low range of normal was like 200 or something like that. So I was definitely low normal.
Right, and B vitamins are crucial to form ATP. So ATP is your energy in your body.
I hate taking that B12 shot.
I know, but boy, it's great for you.
I hate it, but I do it. I do it.
Exactly.
So what would be another? What would be another level that would be possibly suboptimal?
Yeah, I think something that's very important is how your thyroid is functioning. And we see this all the time. The range for your TSH is usually from 0.5 to 4. And optimal TSH is around 2.
Mm-hmm.
And so you see that all the time.
Usually about where I'm at.
Exactly. So subclinical hypothyroidism is rampant.
So if I'm below 2, you think that would be suboptimal?
Absolutely. 2 or below.
And if I were above, if I were 2 to 4, you think that'd be okay?
At 2 to 4 TSH, probably not where I'd really want to be.
Where would you want me to be?
So I would probably want you to be with your TSH about 2, and your free T3 is really very important because that's your most active form of your thyroid. And so free T3, which is usually not even evaluated, is what you really want to ask your physician to check for you.
All right. I'll have to get Andy to check that for me and tell me what it is.
Yeah.
You may know Andy Maddox. He's my primary.
Absolutely.
And he's a biker. So
yeah. Oh, he's going to be right on top of it. Then.
Exactly.
Yeah, absolutely.
All right. So what's another one? I want to get to testosterone. All right. Let's go.
Yeah.
Let's go right for the money.
Okay. Yeah. Testosterone. So here's what's really interesting. So especially if you're an athlete or a distance athlete, is testosterone levels really start to drop in high-level athletes at a lot earlier age than you would imagine. So I'll have 30-year-olds come in, especially the distance runners or the distance cyclists, and they'll start dropping really in their 30s. And what you want to look is if you're in the lower 5th quintile, then you start needing to think about supplementing your testosterone. But you have to keep in mind, if you're of childbearing age, that it can decrease your sperm count. Mm-hmm. So you do need to keep that in mind. But
what about for women? Would women be interested in testosterone, or are they more interested in other hormones?
No, testosterone from women is a wonderful thing. Mm-hmm. So it's not only good for your libido, which we women really do think about, but it's also good for bone density and for lean muscle mass.
And what about for healing injuries? I don't use it in terms of healing injuries, but somebody has tennis elbow or rotator cuff tendonitis.
No, it's been found to be very important for that.
So it helps with healing from these injuries.
Yes, absolutely. So again, very important. And so I see athletes that come in with repetitive injuries, so I'll always check their testosterone.
I'm trying to check the screen, to see if there's calls, but it's hard for me to multitask in that way.
Absolutely.
But I've already learned a lot here. So how does somebody get a hold of you?
So just call the office, 879-8206.
879-8206. And I know you have a website. I just typed in Kim Fagan, MD, and your website came up.
Yeah, Fagan Sports Medicine.
But I think that's very important. So it's your practice has evolved from treating injuries to basically saying, hey, how can we get optimum performance?
Absolutely.
And so I gave you an example of me. What are some other common patients that you see?
Yeah, I think often I'll see somebody that's, they used to be really active, and I think all of us sometimes can kind of let ourselves go a little bit, and all of a sudden they think, okay, I don't feel like I used to feel. And I've gone to my doctor, and they say, everything's okay. They've checked the normal things, and they say, no, you're fine. I've checked all your basic blood work. Nothing's wrong with you. But they say, but gosh, I don't feel good. And I think one of the really common things that people come in and they say, I'm just fatigued.
Right.
I don't feel like myself.
So you somehow motivate them to get more active?
Yeah, and then we'll check all the labs that I was talking about, the expanded thyroid panels, adrenal, a check for adrenal fatigue, check for leaky gut, those things.
Mm-hmm.
And then we go, okay, you're not okay. There are some things wrong.
So you work on the medical aspects.
Right.
I noticed there were a lot of vitamins I saw out there as well. So tell me a little bit about what you do with vitamins and things like that.
Well, you know what I find? That people will come in with a bag full of vitamins that they're taking, and I'll ask them, why are you taking this vitamin? Why are you taking this vitamin? Well, you know, I heard about it on the web, or my friend told me this was good for me. And it's really kind of silly. If you don't need a vitamin, you don't need a vitamin. But what we'll find is when we do the expanded lab panels that there are some very specific vitamins that people need.
So it's not. I didn't even look at great detail at your vitamins.
Yeah.
But I didn't. So there's not, let's say, just a general multivitamin out there. They're just more specific.
Yeah, there are some very specific vitamins that people need. So
Okay.
if you have a specific vitamin deficiency, obviously you need it.
Sure.
Or if you have a leaky gut, there are some very specific vitamins you need. Or if you have adrenal fatigue, there's some specific things that you need. So it's not like I throw vitamins at everybody, the same vitamins at everybody. But again, it's a very targeted approach. It's a very individualized approach. So again, that's what we target. You know, everybody's different, and everybody needs different things.
So my friend Mimi is sitting in the room. Sorry, Mimi, to bring you into this, but just in general, this is where we need somebody on Facebook Live to be able to type in and say, "Hey, this is what's going on with me." You follow me?
Perfect.
But seriously, Kim, it's great to have you do this. Hopefully people will email me or write questions, and then we can follow up
Absolutely.
with various things. I want to get in there to your exercise room one of these days.
Great.
And maybe either I'll get on your machine, because
I'd
love to know my VO2 Max.
Yeah, I'd love to do that.
It's a treadmill test, right?
Yeah, it can be treadmill or a bike, just whatever your
Right,
exercise.
but you have a treadmill
exercise
there,
is.
yeah.
Mhm.
So it will determine, you know, tell me.
Yeah,
I know what
absolutely.
VO2 Max is, but tell us what VO2 Max
So
is.
VO2 Max.
And why it's important.
Sure. So VO2 Max is a treadmill test or a cycling test where we do oxygen exchange, and basically we're looking at your heart rate zone. And but it can be for an athlete or it can be for someone who's trying to lose weight. And basically we're determining the heart rate zone that you should exercise in for your peak performance. If you're trying to really find out what heart rate zone you need to be in to exercise to improve your performance or to lose weight.
Well, can't you just use a formula?
You can use a formula, but that's not very specific for you.
Like, what is it? Is it 220 minus your age, and then like
A percentage of that.
75% of that, something like that?
Exactly. But you can imagine that that's not very specific for you. It's a
Okay.
very generalized sort of formula.
Can I change my VO2 max?
You can with exercise. So if you're exercising, and you can imagine as you improve your performance and you've exercised over a period of time, you can imagine you can change that some.
Mhm.
And so that's why if you're using that formula, it's not going to be very specific.
You know, those they have the Apple Watch now, but they have the Fitbit and all that stuff, and I have issues with that because it doesn't give me the information that I think I need in order to improve.
Right.
So when I'm playing a sport, I want to know what my heart rate is while I'm competing and while I'm resting. Does
Correct.
it give that information?
Some of them will. Some of them more the newer models will. But again, you have to
I don't
worry
want
about
to just
how
know how
specific.
many steps I'm taking.
Exactly.
I want to know what my heart rate is and I want to know how long I am
In that zone.
in that zone. So then when I train, I know to run for 20 seconds and then stop. Run for 20 seconds and stop.
Exactly.
Like, you know, the problem with running for fitness is you start once and you stop once. And with tennis, you're starting and stopping
All the time.
all the time. So how is that an activity that will help my tennis? I don't see it.
Yeah. No, that's probably not very good for tennis.
Right.
Probably not very good for
So
tennis.
figuring those things out, but I'm hoping, I'd like to know what my blood sugar is while I compete.
Oh, that would be excellent if you could do that.
Because
Yeah.
sometimes I get like if I eat at the wrong time, I get hypoglycemic. Does that make sense?
It does.
Like if
It
I
does.
eat like within 60 minutes of playing, I'll get on the court and I'll be drained. I will have no energy.
Absolutely. Have you seen that new model? It's on television. I can't remember the name of it. Where it's the arm thing.
Mm-mm.
Yeah, and I wish I could remember the name of it. It's an armband, and you just can touch it, and it shows you your blood sugar.
Oh no, that would be awesome.
Yeah, it's amazing, but I forgot the name of it.
So do you do anything with blood sugar in terms of working with athletes on how to
With
how
diabetics.
to eat?
With diabetics.
Just with the diabetics,
Yeah.
not with the people who are non-diabetic.
Not really. It's mainly with diabetics that I work with.
And the other issue that I struggle with is sweat. Is I grew up in the day where we did not drink water, and so frankly, I'm a camel. I mean, when I compete, I really don't need water. I need it, but in taking it in by mouth through the gut is just, to me, ineffective.
Yeah, there's
so
a sweat test.
I keep IVs in the car.
No, there's a sweat test. There's a sweat test.
Yes.
That we do.
You do sweat tests.
Mm-hmm. There's a sweat test.
And what does that tell you?
Basically, it tells you what kind of electrolytes you need to use to stay hydrated.
Right. So Gatorade, just taking a bottle of Gatorade ain't going to cut it.
No, probably not. It's a sweat test. We recommend that you do it during your training and during the different types of seasons, so that you'll know what type of electrolytes and how much you really should take in.
That's awesome.
Yeah.
So do you do that at the same time you do the VO2 Max?
No, we probably should do it there, but it's better to do it out in where you're going to be training. So not at the time you're doing your VO2 Max, but really in the environment you're going to be doing your training.
What do you think about that? I keep my IVs in the car.
I like that idea.
I've used it on many an occasion.
Well, when you're out playing tennis and the kind of heat that y'all are playing in, it's probably a good idea. When I was out covering football teams and things, usually at halftime, we were shoving IVs in them.
Yeah, see, that's the stuff you don't see on TV.
No, you don't.
You don't hear about it.
And let me tell you, if one football player started doing it, they all wanted to do it. So half-times that's what I was doing half the time, we're putting IVs in.
Interesting. Well, I'm gonna say thank you so much.
Oh, Fred, it was an honor. Thank you so
well,
much.
hardly an honor,
No,
but
absolutely.
I hope you see the potential of this medium where we can
Great
grow
fun.
this.
I appreciate it.
Thanks, Kim.
Yeah,
appreciate
absolutely.
It. Great to see you.
You too.
All right, so this is where the real show starts. Is the time between I hit the stop button and we're still live.
Bye.
Bye. Let's see. Okay. I'm going to hit finish.